Hi, this is Dr. Sinagra. It is October 7, 2015. I'm here with my patient, Michelle Hill. Hi, Michelle.
Hi, how are you?
This is a very casual testimonial. We like our patients at various stages of their treatment and following our programs to come on and give us a little testimonial. So people at home that are flipping through and pick up a testimonial can say, oh, that's a lot like me. Now, you started less than 3 months ago, I believe. Just about 3 months, I'm sorry. And if I remember correctly from reading your paperwork, please tell everybody what your symptoms were and what your health was like prior to coming in. What brought you into the office?
I had discovered, I think 9 months before I walked in, that my thyroid started to not work.
Mm-hmm.
I had half a thyroid and it always worked, and then the levels started to fluctuate. And when I had a blood test, the antibodies started to raise. So I got really concerned because I knew that was an autoimmune disease. I've had a heart attack and 2 stints. I knew I had inflammation, but I thought I was managing it. So I went on a compounded thyroid med, and the first 3 months I didn't absorb it. The next 6 months I took more. And it really didn't do much. Then something else happened in my life, and I was looking for a place for my father to go because he was a diabetic and I wanted to get him off meds. And I saw you guys on the internet and I said, I need to go there.
Okay. We put you on a 6-month program. You're just at the halfway point, and we redid your blood. Again, we know that you're not perfect. We know you're not 100%, but again, we want these to come across as being honest and showing different phases of care. You're improved dramatically in your blood work. One of the things that was amazing is that your C-reactive protein, which is an inflammatory marker, was 76.6. Now the range is 0 to 4.9. So from 4.9 to 76 is a big difference. Do you remember what your number was when we just redid your blood?
1 something?
1.
1, okay.
So you went from 76
to 1.
Right. On a major inflammatory marker.
When I walked in here and you did the blood work and I realized how inflamed I was really scared.
Well, because you have a history of heart disease and heart attack.
Yes.
And inflammation is cardiovascular disease and coronary disease is an inflammatory process. Yeah, it's inflammation.
Yeah.
Here's the other thing that I noticed that was real good. Your estrogens weren't very high when you got here. Now they're down to normal, which is amazing. Also, your rheumatoid factor. Your rheumatoid factor was 16.6. I'm sorry, 14.3. I apologize, I read it wrong. Now, 0 to 13 is normal. Once you go above 13, you're positive for rheumatoid factor, which means you can have one of the rheumatoid illnesses.
Yeah.
We redid your blood again last week, and do you remember what your new one is?
What was it, 13?
9.9.
9.9.
So you went from a rheumatoid factor of 14.3 to a rheumatoid factor of, and I got it right in front of me, 9.2. Do you know that's amazing?
I didn't know how amazing.
Yeah, it really is.
Yeah, first of all, I was so shocked that I was positive for that, because that scared me more. I thought I was managing it, so when I got the first blood work, I was like, oh my God, I'm in serious trouble. I need to do this and commit.
So the combination of upper cervical chiropractic care, diet change, supplementation, and metabolic rebuilding, you're halfway through.
Yeah.
How would you describe your improvement?
I have to say, well, I lost some weight, which is always good. I didn't really need to lose a lot, but I started to gain it in the middle. And again, that was another flag going, this is not good. I thought I was sleeping fairly well, but I would say probably 2 months into the program with the supplements and your protocol, I started to sleep like I've never slept before.
Not great. We're restoring your health.
Yeah.
The main thing is 3 months is not a lot of time.
I know.
And you've done phenomenal.
Yeah.
I'd like you to come back in 3 more months and do a follow-up when you're done with your program.
Okay.
Would you recommend it to everybody else?
Absolutely. Another thing that is really key for me is a calmness, a much easier way of dealing with things. So I thought that was the sugar, but I think it's the whole protocol.
I
Yeah.
think everything is.
Yeah.
You're doing great. Michelle, thank you for your time today.
You're welcome.